Breastfeeding tips and guidelines. Breastfeeding has many advantages for both the baby and the mother. There are many substances in breast milk that can't be found in cow's milk. More so, there are fewer complications associated with breast milk than with cow's milk. It has been advertised time and again that it is best for the babies if they are breastfed for the first 6 months, even up to 2 years. So why is breast milk so beneficial for the baby? First of all, only breast milk contains colostrums, which are essential for the baby to take. Commercially made milks cannot simulate the colostrums made by a mother. The colostrums contain natural antibodies and immune globulins that are responsible for keeping the baby free from illness for the first few months of its life. Another advantage breast milk has over cow's milk is that it allows the mother to save, as cow's milk can be expensive. The baby can better adapt to breast milk. Their feces are not smelly, and they don't have any difficulty defecating compared to cow's milk. Breastfeeding has also been approved to be one of the family planning methods that a family can observe. Since breastfeeding has been given so much importance, many women have been made aware. However, despite the awareness, many mothers still report of breast problems associated with lactation. These problems are most often than not associated with improper breastfeeding techniques. In order to lower down the incidence of breast-related problems due to lactation, it is important that mothers observe the proper techniques of breastfeeding. Ultimately, both the mother as well as the baby will benefit from the proper observance of these techniques. First of all, you need to prepare your breast for milk production. There are various nipple exercises to perform in order to prepare your nipple to deliver the breast milk to your baby. One of these exercises would involve routinely pinching the nipple. Second, and what most mothers fail to realize, is how to keep the nipple clean before the baby latches onto it for feeding. When you plan to breastfeed, you should avoid using soap on your nipple. If this cannot be avoided, your nipple should be wiped using a soft cloth soaked in clean water to make sure your nipple is clean before your baby feeds from it. Third, and perhaps the most important step, is to allow your baby to properly latch on to your nipple. You will know when your baby is latched on properly when your baby's mouth covers the entire areola and not just the nipples. It is essential that your baby should latch on properly so that he or she can properly stimulate the let-down reflex of your breasts, wherein the milk will go down the ducts and out your nipple. To aid your baby in latching on properly, you should make use of their rooting reflex. This is manifested in the first few months of life. You stimulate your baby's cheek, near their mouth, using your nipple, and their head will automatically turn towards the stimulation. Their mouth will open and be ready for receiving your nipple. Once you're done, you can aid your baby to stop latching on by inserting a clean pinky finger into the side of their mouth and propping it slightly open. Your baby will stop sucking and you can remove your nipple. To prevent sore nipples and breast engorgement, you have to monitor the amount of time your baby sucks with each nipple. It is usually advisable to spend 10-15 minutes each breast to make sure that the breasts are completely emptied of milk. This will prevent breast engorgement. The next time your baby feeds on your breast, let your baby feed from the last breast he or she fed on. This will completely empty the milk on that breast before you move on to the other breast. Breastfeeding, how important is it? Years ago, perhaps when you were a child, breastfeeding was not very popular. Breastfeeding was not encouraged as it is in today's society. Doctors didn't fully grasp how important and beneficial it is for a newborn baby. Because of this, and a few other reasons, there were many new mothers that went directly to feeding with the bottle. Most often new mothers didn't even try to breastfeed their new baby. Breastfeeding helps protect and nurture your baby in innumerable ways. There have been many studies in regard to breastfeeding babies, and the results have shown increases in brain power within as little as 6 weeks of breastfeeding. The study has also shown a reduced risk of obesity due to the fact that breastfed babies are much less likely to overeat than formula-fed babies. Overall, babies that have been breastfed for roughly 6 months are also less likely to have breathing problems. We now know how nourishing breast milk is for your baby. Breastfeeding is highly recommended by doctors as well as healthcare professionals. Further, it's been shown that breast milk supports brain function as stated above and also provides valuable nutrients that would not otherwise be available. Breast milk is very special. Every mother's milk is slightly different, tailored to her own baby's needs. A baby's immune system is directly affected by the breast milk of her mother. Every feeding time is an extremely important time of the day. It allows the mother and baby time to bond to each other without any distractions. A new mother will really get to know her baby by breastfeeding and will feel much more at ease with him or her during breastfeeding. Milk-induced sleep is one of the most wonderful things a mother will experience. Newborns love to be cuddled and they also love to eat. When you combine the two, you get an extremely sleepy baby who will snuggle up in their mother's arms long after the feeding is over. Breastfeeding will instill a nap time, but you'll find yourself continuing to rock your precious little one. It's calming to mother as well. Babies have a built-in latching instinct, although some babies will not latch properly, causing pain to the mother. You'll detect these problems early on and you'll find that most hospitals have a nursing specialist that will help to determine if your baby is latching on wrong. If you continue to have problems in this area in the first week, you should consult with your doctor. With a little practice, you'll be a pro in no time. Hang in there, it's worth it. Breast milk is not only good for your baby, but it's also good for the mother as well. It has been stated that mothers who breastfeed their babies for at least 6 months have shown a dramatical reduction in the risk of various types of cancer, including breast cancer and ovarian cancer. Another happy note: through breastfeeding, new mothers will also lose the additional weight she gained while pregnant, and another benefit is that it will also help her uterus contract to its pre-baby size. All new parents want to give their babies the very best, and when it comes to nutrition, the very best first food for baby is breast milk. Although you may experience a few challenges at first while breastfeeding, it will be the best experience a new mother will have. There may even come a time later in life when you look back on this wonderful experience and wish that you had breastfed your baby longer.